Anita is a 4-year-old child that is admitted to the pediatric unit for diagnosis and treatments of a new seizure disorder. Our presentation will focus on the nursing process.
Assessment. In addition to obtaining a complete physical and neurological exam, there are some other useful steps that the nurse can take to help gain a better perspective of the patient's history. First, determine whether epilepsy or a seizure disorder exist and not an alternative diagnosis. Then, define the underlying cause. It will be important to ask about any precipitating factors that may have led to the seizure. Fever, infection, head trauma, anxiety, fatigue, and sleep deprivation should all be investigated when gathering information during your assessment. There are numerous conditions and disorders that mimic the signs and symptoms of a seizure, so it will be important that you, as the nurse, ask detailed questions to differentiate among them. Also, it is significant to get an accurate account of the seizure, including the type, duration, any specific pattern it follows, and the behavior that accompanies it. A specific pattern could be that it occurs only in the morning, after meals, or at bedtime. Asking the parents to mime the seizure instead of just their oral description will be most helpful in understanding the seizure characteristics. As the nurse, you will also want to obtain a thorough family history. Ask if any other member of the family has a history of seizures or any other neurological disorders. If available, review the patient's labs and neuroimaging test results. Important labs to consider are venous lead level, white blood cell count, blood glucose level, serum electrolyte levels, and a tox screen. CT scan, MRI, and EEG should all be performed. However, obtaining an EEG has been found to be the most useful with seizure disorders. In addition to the complete physical and neurological examination that you performed, these questions and helpful hints will be beneficial in assisting the medical team with the diagnosis of a seizure disorder.
Diagnosis. A priority nursing diagnosis for Anita would be risk of injury related to seizure activity. A nursing diagnosis that includes Anita's family would be anxiety and fear of parents related to the child having life-threatening and incapacitating seizure activity. Anita has been medically diagnosed with tonic-clonic seizures and is placed on Dilantin.
The word seizure is a general term used to describe the medical condition in which too many brain cells become excited simultaneously.
There are so many kinds of seizures that neurologists are still updating how to classify them. Usually they classify seizures into two main types, partial seizures and primarily generalized seizures. The difference between these types is in how they begin. Primarily generalized seizures begin with a widespread electrical discharge that involves both sides of the brain at once. On the other hand, partial seizures begin with an electrical discharge in one limited area of the brain. All generalized seizures begin with synchronous electrical activity throughout the brain, accompanied by sudden generalized movements or loss of consciousness. However, there are still many different types of generalized seizures. A tonic-clonic seizure, once called a grand mal, is what most people think of when they hear the word seizure. When someone experiences a tonic-clonic seizure, first they stiffen and lose consciousness, which is the tonic phase. Then they begin jerking, and this lasts for several minutes, called the clonic phase. Sometimes seizures don't have a tonic stiffening and a clonic jerking sequence, but are just tonic seizures or clonic seizures.
Plan. Plan of care includes administering the anticonvulsants as ordered by the physician and maintaining patient safety. Anita's parents will need to be included in this plan and educated about the drugs she will be taking. Implement. Seizure disorders can be controlled in 70% of patients with the use of epileptic medication. The anticonvulsants are a diverse group of pharmaceuticals used in the treatment of epileptic seizures. In epilepsy, an area of the cortex is typically hyperirritable that can often be confirmed by completing an EEG. Anti-epileptic drugs function to help reduce this area of irritability and thus prevent epileptiform seizures. If a patient begins having a seizure, The most common and effective drug given at home or pre-hospital is a benzodiazepine. Benzodiazepines are minor tranquilizers or sedatives that prevent or stop seizures by slowing down the central nervous system. This makes abnormal electrical activity less likely. For children or adults who have occasional clusters of seizures despite long-term drug therapy, rectal diazepine may be a good choice for treating them at home. It usually stops the series of seizures quickly, and family members can treat the person at home safely and easily. Family members should be aware of the most common side effects of benzodiazepines, which include drowsiness or sedation, loss of muscle coordination, behavior changes such as nervousness, confusion, or aggression, and loss of appetite. Ending these types of repetitive seizures can prevent status epilepticus and other problems associated with prolonged seizures. Status epilepticus is defined as a continuous seizure that lasts more than 30 minutes, or a series of seizures from which the child does not regain a premorbid level of consciousness. Pharmacological interventions can help families avoid emergency room visits.
A teaching plan regarding drug therapy with Dilantin should also be included. The generic name of Dilantin is phenytoin. It is an anticonvulsant that minimizes seizure activity. It's usually prescribed 3 times a day with meals to minimize GI problems and should be taken at the same time each day. Common side effects of Dilantin include rash, nausea, drowsiness, involuntary eye movements, double vision, and loss of muscle coordination. It's important to notify the physician if your child is on herbal supplements, if they experience behavioral changes, fever, sore throat, or GI changes such as vomiting or pale stool. It's also important to teach the parents to maintain dental hygiene and keep regular dental appointments to prevent enlargement of the gums. Don't stop taking the drug unless the doctor tells you to, as this can cause status epilepticus. And also, not all brands of phenytoin are equivalent. The therapeutic effects may be altered if you mix different brands. And finally, notify school teachers and other care providers that your child is taking Dilantin.
While you are giving a bath in bed, Anita begins to have a seizure. How should you intervene to care for Anita and prevent any injury to her? It is important for the nurse to remain calm, stay with Anita, and begin timing the seizure. A seizure cannot be halted once it begins, and no attempt should be made to do so. The bed rails should be raised so Anita does not thrash and fall out of bed. If possible, Anita should be placed on her side to allow saliva to drain. Sometimes the swallow reflex is lost, the tongue is hypotonic, and the side-lying position prevents aspiration. The nurse should pull a curtain to provide privacy, and if family members are present, reassure them everything is being done for Anita. It is important to prevent Anita from sustaining harm during the seizure. Placing a pillow against the bed rails to protect her head may help. However, do not let the pillows occlude her airway. Never try to restrain a child or place an object between her teeth. When the physical seizure activity ends, it may take several minutes for Anita to become responsive, so continuously monitor Anita's airway and reassure her in a calming voice.
It's important to remember when administering the prescribed medications that each anti-epileptic drug may have slightly different side effects. Common side effects include dizziness, drowsiness, fatigue, nausea, tremor, rash, and weight gain. Most of these side effects lessen with time. Long-term effects vary from drug to drug. Anticonvulsants can cause problems with the liver over long-term use, so your doctor should monitor your liver closely. Unfortunately, 20 to 30% of epileptic patients do not respond to drug therapy. Those who do not respond to medication have other options such as surgery or modified diets.
Evaluation. We will evaluate the effectiveness of our interventions based on the fact that our patient remains free from injury during epileptic episodes. The frequency and duration of the seizures will be decreased. We would also like to take this time to educate the family on taking care of Anita at home.
It is important to educate the parents about keeping Anita safe at home. Some of these tips include: raise side rails when Anita is sleeping or resting, Pad side rails and other hard objects. Place waterproof mattress or pad on the bed or the crib. Have Anita wear or carry medical identification. Instruct Anita in precautions to take during potentially hazardous activities such as bathing only with close supervision. It is important that if Anita is swimming, she swims with a companion. Have Anita use a protective helmet and padding when engaged in bicycle riding. And alert other caregivers the need for any special precautions.
There are many accredited associations that have websites offering the most comprehensive, medically approved consumer information about epilepsy. The following are a few of these organizations.